Imagine this situation. You wake up in your bed, in your room. Everything is as usual. Light filters through the curtains. The sounds of the street come through the window. Maybe your cat is meowing, demanding breakfast. You get up, go to the bathroom, turn on the light, look at your reflection in the mirror, and suddenly you realize something horrible. Something so fundamentally wrong that your whole world turns upside down. You realize you are dead. Not I feel tired, not like a zombie, not a metaphor. No. You're absolutely 100%, with every cell of your being convinced that you are a corpse, a walking dead person. Your heart does not beat, or if it does, then it's some kind of mistake, some last residual reflex. Your blood does not flow through your veins, or it is no longer blood, but something rotten. Your organs have decomposed. You are dead, but for some reason you continue to move, think, exist in this nightmarish in-between state. And the worst part? No one believes you. Doctors show you an ECG, blood tests. They say, look, your heart is beating. You're alive. Your loved ones hug you, try to convince you. But you know the truth. You feel this deadness inside. And all these people around either do not understand what is happening or, which is even scarier, are deliberately lying to you, participating in some kind of insane performance. This is Cotard syndrome. And now I'm going to tell you about this madness as thoroughly as I can, because it is one of the strangest, scariest, and at the same time, most mesmerizing things the human brain can produce. Let's move to the late 19th century, Paris, 1880. A time when psychiatry was only just beginning to take shape as a real science. There are still a few years before Freud. Psychoanalysis doesn't exist yet, but doctors are already actively studying strange cases of madness, trying to understand what is happening inside their patients' minds. And in this atmosphere works the French neurologist Jules Cotard, an ordinary doctor, one of many. But one day a patient comes to him who will overturn his understanding of how far human madness can go. He called her simply Mademoiselle X, as was customary in those days to preserve anonymity. This middle-aged woman came to him with complaints that sounded absolutely unbelievable. She claimed, and said it completely seriously without a hint of doubt, that she had no brain. Yes, you heard that right. She believed that inside her skull there was nothing. Moreover, she said she had no nerves, no chest cavity, no stomach, no intestines. I have only skin and bones left, she repeated over and over. Cotard tried to convince her otherwise. He showed her how she moved. And how can one move without nerves? How she thought and spoke. And how is that possible without a brain? But the woman was unshakable. For her, this was absolute truth, the reality she lived in. And then the most frightening thing happened. The woman's logic was ironclad. If I have no internal organs, why should I eat? The dead do not need food. And she began to refuse food, completely. The doctors tried to feed her by force, pleaded with her, begged her. Her relatives were in despair, but she stood her ground. In the end, after several months, Mademoiselle X died of starvation. Her body simply could not withstand the fasting. Cotard was shocked. He began collecting information about similar cases and discovered that they did exist. It was just that no one had systematized them before. In 1882, he presented a report to the medical community, describing this condition as the delusion of negation, délire de négation. He identified several stages of this madness. The first stage is mild depression with hypochondria. A person begins to worry excessively about their health, constantly finding symptoms and illnesses in themselves. The second stage is the emergence of ideas about one's own death or non-existence. A person begins to believe that some part of their body is dead or has disappeared. And the third, most severe stage is complete delusional negation and ideas of immortality. A paradox. A person simultaneously considers themselves dead and immortal. They are dead, but cannot die completely, doomed to eternal existence in this cursed state. The community met his report with skepticism. Many colleagues thought that this was simply a very severe form of depression or schizophrenia, not deserving a separate name. But Cotard insisted, this is a distinct phenomenon that requires study. And over time, other doctors began finding similar cases, confirming his observations. That is how the syndrome received the name of its discoverer, Cotard's syndrome, or walking corpse syndrome, or Cotard's delusion. It sounds like the title of a B-grade horror movie, but it is a medical term still used today. All right, now let us figure out the most interesting part. How can the brain even come to such an insane conclusion? How can an organ that evolved over millions of years to help us survive suddenly decide, you know what, buddy, you're a corpse? To understand this, we first need to look at how our self-awareness works. When you look in the mirror, a whole bunch of incredibly complex processes unfold. Light reflects off your face, enters your eyes, transforms into nerve impulses, travels to the occipital part of the brain where visual information is processed. Then this data goes to the temporal lobe, where there's a special area responsible for recognizing faces. This thing is called the fusiform gyrus, or the fusiform face area if you want to show off with a scientific term. This area is a true genius of recognition. It can differentiate thousands of faces. It remembers faces you haven't seen in years. And it's the first one to shout alarm when you see someone familiar, especially when that person is you. But recognizing a face is only half the job. Simultaneously, another system kicks in, the emotional one. Deep inside, the brain is something called the limbic system. Inside it is the amygdala, which is responsible for emotions, especially fear and anxiety. And there are many other structures there that together create what we call feelings. When you see your own face, your brain doesn't just recognize the image, it adds an emotional layer to it. That's me, familiar, safe, mine. You feel a connection to that reflection, that warm, familiar feeling of yourself. Now imagine that the connection between these two systems, recognition and emotion, breaks. You look at your face, your brain recognizes it visually, but the emotional response never arrives. Zero. Emptiness. No sense of, that's me. You look at yourself as if at a stranger, a mannequin, an object. It's creepy. Genuinely creepy. And your brain, naturally, starts trying to find an explanation. Why don't I feel myself? Why does this reflection seem foreign? And then the brain, trying to create a logical picture of the world, comes to a conclusion. I'm probably not alive. I'm probably dead. That is the only explanation that makes sense to it. This is called de-affectivation, the loss of emotional connection to reality. A similar thing happens with Capgras syndrome, only there the person thinks their loved ones have been replaced by doubles. The mechanism is the same. I see my mother, I recognize her face, but I don't feel that she is my mother. So it must not be her, but someone who looks like her. But in Cotard's syndrome, it's even worse because this de-affectivation spreads not only to the reflection, but to the entire body, to the very sense of life inside. A person stops feeling like a living being. Scientists conducted several brain studies on people with Cotard syndrome using MRI and PET scanning. And you know what they discovered? Reduced activity in the frontal lobes and parietal areas, the very ones responsible for self-awareness and body connection. And also abnormalities in the functioning of the basal ganglia, structures involved in forming emotions and motivation. It turns out that the brain of a person with Cotard syndrome literally works differently. Entire regions seem to fall asleep, to shut down. And in this silence, in this emotional deafness, delusion is born. Theory is good, but now let's talk about real people who actually went through this, because only then do you truly start to understand how terrifying and strange it really is. First story. A woman, let's call her Maria, 45 years old, a housewife, mother of two. She had always been an ordinary person, no mental health issues at all, but after her mother's death, she fell into a deep depression. It started pretty normally. Sadness, apathy, lack of motivation. Her husband convinced her to see a therapist. She began antidepressant treatment. But instead of improvement, Maria's condition got worse. She started complaining about strange sensations in her body. She said she couldn't feel her heartbeat. She would place her hand on her chest and say, "Look, it's not beating." Her husband rushed her to a cardiologist in panic. The ECG showed a perfectly normal heart, beating steadily. But Maria didn't believe it. Then it got worse. She began saying she could smell something. The smell of decay. She was convinced it was the smell of her own internal organs rotting inside her. Her husband and kids smelled nothing, but for Maria, this smell was real and unbearable. She started taking showers constantly, 5 or 6 times a day, trying to wash off this corpse smell. Then she stopped eating. "Why do I need food if my stomach is dead?" she would ask. Doctors admitted her to a psychiatric clinic and started intensive treatment. They gave her IV nutrition and strong antipsychotic medications. She lay in the ward repeating the same thing over and over. "I'm dead. Why are you keeping me here? Take me to the cemetery. I belong with the dead." Treatment lasted almost a year of medication, therapy, conversations. Slowly, very slowly, Maria began to come back. First, she admitted that maybe her heart was beating after all. Then she agreed that the smell of decay might have been in her mind. Then she started eating. At first, just a little, very carefully, but she ate. When she was discharged, she told psychiatrists that it felt like living in hell. Imagine you are dead, but your consciousness works. You exist in some suspended state between life and death. You want to disappear, dissolve, finally die for real, but you can't. It's an eternal curse. Second story. A guy, let's call him David, 28. A programmer, smart, successful. After a car accident, he suffered a traumatic brain injury. Not too severe, doctors said he would recover. And physically, he did recover quickly. But psychologically, something went wrong. A few weeks after being discharged, David began saying strange things. He claimed that his soul had left his body during the accident, that he saw it leave and now there is no one inside his body. He is just an empty shell, a biological robot functioning out of inertia. His friends thought he was joking. He always had quirky humor. But he was serious. He could spend hours explaining his theory. His real self died in that accident, and whatever is walking and talking now is just leftover neural patterns, an imitation of life. David tried to prove his condition. He cut himself to show that he didn't feel pain. He did feel it, but interpreted it as signals in an empty shell. He stopped talking to friends and family, saying, "Why? I'm not here. You're talking to nothing." He was hospitalized when his parents found him in the bathroom with a knife, trying to see what's inside the empty shell. Thankfully, the wounds were superficial. David was diagnosed with Cotard syndrome that developed after the brain injury. Treatment involved antidepressants, antipsychotics, and cognitive behavioral therapy. Interestingly, David, being a programmer, tried to analyze his condition rationally. He understood that from other people's perspective, he was alive, but his own internal experience told him the opposite, and this contradiction tore him apart. "I know I'm supposed to be alive, but I don't feel it," he said. Third story. An elderly woman, let's call her Mrs. Johnson, 73. Her Cotard syndrome started after a stroke, but her case was unique. She didn't just believe she was dead, she believed she was in purgatory. According to her, she had died, but didn't go to heaven or hell. Instead, she was stuck in some intermediate place that looked exactly like her old home, but was actually a prison for souls. The people around her, her children, grandchildren, nurses, were either demon jailers or other imprisoned souls pretending to be alive. Mrs. Johnson prayed constantly, begging God to take her to end the trial. She refused food, not because she considered herself physically dead, but because she believed souls don't need food, and eating only prolonged her suffering in purgatory. This shows an interesting point. Cotard S syndrome can take different forms depending on the person's cultural and religious background. In Christian cultures, it may involve purgatory or hell. In other cultures, different interpretations of death and the afterlife. All right, we've talked about what it looks like and feels like. Now let's dig deeper. Why does this even happen? What factors lead to a normal human brain suddenly deciding, "That's it, I'm dead"? The first and most important thing, Cotard syndrome almost never appears on its own. It's not a separate disease, it's a symptom, a complication of something else. Like a fever during the flu. The fever isn't the illness, it's the body's response to an infection. The most common cause is severe depression. Not that light sadness when you just want to get out of bed for a couple of days. No, this is about clinical severe depression when the brain literally doesn't produce the necessary neurotransmitters. Serotonin, dopamine, norepinephrine, all these chemicals that are responsible for our sense of life, joy, motivation, their levels fall into an abyss. When depression reaches a certain depth, a person stops feeling anything at all. This is called anhedonia, the inability to experience pleasure. But with Cotard syndrome, it goes even further. A person stops feeling not only pleasure, but the very sense of life inside them. Imagine that all your emotions, all your sensations, as if someone turned their volume down to zero. You exist in absolute emotional silence, and in this silence, a thought is born. Maybe I'm dead? And the second common cause is bipolar disorder, especially the depressive phase. With bipolar disorder, a person swings between mania, when they're on top of the world, full of energy, feel like a god, and depression, when they fall into an abyss. And during this fall, in the deepest point, Cotard syndrome can switch on. The third cause is schizophrenia. Here, the mechanism is a bit different. In schizophrenia, the perception of reality as a whole is disrupted. A person may hear voices, see things that aren't there, believe in complex, delusional systems. And Cotard syndrome can be part of this delusion. Voices may tell the person that they're dead, or they themselves may come to this conclusion while trying to explain strange sensations in their body. The fourth cause is physical brain damage, strokes, traumatic brain injuries, brain tumors. If certain areas are damaged, especially the parietal lobes, which are responsible for body schema and self-awareness, or the frontal lobes, which are responsible for critical thinking, Cotard's syndrome may develop. The brain, trying to compensate for the damage, creates an erroneous picture of reality. The fifth cause is side effects of certain medications or drugs. There are documented cases where Cotard's syndrome developed after taking certain antiviral drugs, some antidepressants, or after using heavy drugs like ketamine in large doses. The sixth cause is neurodegenerative diseases like Parkinson's disease or dementia. When the brain gradually deteriorates, many strange symptoms may arise, and Cotard's syndrome is one of them. Interesting fact. Cotard's syndrome is more common in women than in men, approximately at a 3.2 ratio. Why? No one knows for sure. Perhaps it's about hormones. Estrogen and progesterone affect brain function, and their fluctuations, especially during menopause, may increase the risk. Perhaps it's because women suffer from depression more often, or it might just be statistical error due to the small number of cases. The syndrome is also more common in elderly people. Again, the reasons are not fully clear. Maybe it's about age-related brain changes, accumulated minor damage, changes in chemical balance. But here's what's interesting. Cotard's syndrome is extremely rare. It's difficult to collect exact statistics because many cases may be misdiagnosed or never reach doctors at all. But according to approximate estimates, it's a few cases per millions of people. It's rarer than schizophrenia, which affects about 1% of the population. Rarer than bipolar disorder, around 2 to 3%. It's truly a rare phenomenon. Okay, let's imagine the worst case scenario. Your close person has developed Cotard's syndrome. They say that they are dead, refuse to eat, may try to harm themselves. What should you do? Can this be treated at all? The good news? Yes, Cotard's syndrome is treatable. The bad news? It's long, difficult, and not always 100% effective. But in most cases, people can be helped. The first and most important thing is hospitalization. A person with Cotard's syndrome is dangerous to themselves. They may refuse food and water, may try to prove their dead state by injuring themselves. Therefore, the first step is to the hospital under supervision. Then medication treatment begins. The choice of medication depends on the main cause. If the syndrome developed on the background of depression, powerful antidepressants are needed. Usually SSRIs, selective serotonin reuptake inhibitors, like fluoxetine, sertraline, or escitalopram are used. But in severe cases, tricyclic antidepressants may be prescribed, which are stronger but have more side effects. If there are psychotic symptoms, delusion, hallucinations, antipsychotics are added. Risperidone, olanzapine, quetiapine. These medications help mute the psychosis, return the brain's ability to distinguish reality from delusion. If the basis is bipolar disorder, mood stabilizers like lithium or valproic acid are needed. But here's the problem. Medications don't start working immediately. Antidepressants need from 2 to 4 weeks to develop an effect. And the person is suffering right now, refusing food, may harm themselves. What to do? In the most severe cases, electroconvulsive therapy, ECT, is used. Sounds scary, right? All those Hollywood movies show ECT as torture, where a person is tied to a bed and electricity is run through them and they shake in convulsions. But modern ECT is nothing like that. A person is put under short anesthesia, given muscle relaxants, so there are no convulsions that can damage muscles and bones, and only then a small electric impulse is passed through certain areas of the brain. This causes a controlled seizure which somehow, the mechanism is not fully understood, reboots the brain, restores the normal work of neurotransmitters. ECT sounds creepy, but actually it is one of the most effective procedures for severe depression and Cotard's syndrome. Many patients show improvement after just 3 to 4 sessions. Of course, there are side effects. Temporary memory loss, headaches, confusion for a few hours after the procedure. But for a person who is convinced that they are a corpse and wants to die, this is a small price for returning to reality. Besides medication and ECT, psychotherapy is very important. But here there is a difficulty. How do you conduct therapy with a person who thinks they are dead? How do you convince a corpse that it is alive? Therapists use several approaches. Cognitive behavioral therapy, CBT, focuses on gently challenging delusional beliefs. Not directly. You're not dead. Look, you're breathing. That doesn't work. But gradually, through small experiments. For example, the therapist may suggest, all right, let's accept your hypothesis that you are dead. But then dead people don't have a heartbeat, right? Let's check your pulse. The patient feels the pulse. Interesting. How do you explain this? The goal is not to immediately persuade, but to plant a seed of doubt in the delusional system. Or another approach. The therapist asks the patient to describe what they feel. You say that you're dead. What do you feel when you say that? And gradually, the person begins to realize that actually they still feel something. Fear, for example, or despair. But do dead people feel fear? And again, a small crack in the armor of delusion. Supportive therapy for the family is also important, because living with a person who believes they are a corpse is incredibly emotionally difficult. Relatives need help to understand what is happening, how to communicate with the patient, how not to lose hope. As for the prognosis, it strongly depends on the cause. If Cotard's syndrome developed after a traumatic brain injury or a stroke and the brain is recovering, then the symptoms often go away completely. If the cause is depression and the right treatment can be found, there are also great chances for full recovery. Things are worse if the syndrome developed against the background of schizophrenia or dementia. Here it may be more resistant to treatment, returning again and again. But even in these cases, improvement is possible, making the person's life more tolerable. The most dangerous thing is if the person receives no treatment at all, like that Mademoiselle X from Cotard's original description. Without treatment, a person may die from exhaustion, dehydration, or as a result of self-harm. You know what else is interesting? How Cotard's syndrome is perceived in different cultures and how it has seeped into pop culture. In Western culture, the image of a walking corpse immediately brings associations with a zombie apocalypse, with horror films, with reanimated bodies. And of course, this influenced how the syndrome is portrayed in movies and literature. For example, there is an episode in the series Hannibal where one of the characters suffers from Cotard-S syndrome. The creators of the show very atmospherically depicted what it looks like from the inside. The world becomes gray, lifeless. The person sees their own reflection as a decaying corpse. Visually, it's creepy, but in fact, it quite accurately conveys the subjective experience of the patient. In the anime Paranoia Agent, there's a character who believes he is a ghost, a dead person wandering through the world of the living. This is also a reflection of Cotard's syndrome, although it is not directly named. There are examples in literature as well. In some Gothic novels of the 19th century, characters describe states very similar to Cotard's syndrome, although the authors themselves may not have known the medical term. But here is what's interesting. In non-Western cultures, the syndrome can manifest differently. For example, in some Asian cultures, where the idea of reincarnation is very strong, a person with Cotard-S syndrome may believe that their soul has already been reborn in another body, and this shell is just an empty husk. In African cultures, where beliefs in voodoo magic and zombification are widespread, a person may interpret their condition as the result of a curse or magical influence. They may believe that a sorcerer turned them into a zombie, not in the Hollywood sense of a brain-eating monster, but in the traditional sense, a person whose soul was stolen and turned into a powerless slave. This shows something important. Cotard-S syndrome is not just a set of symptoms. It is an intersection of neurobiology and culture. The brain produces an error, I don't feel alive, and the cultural context determines how this error will be interpreted and expressed. And now let's do a bit of philosophizing. Because Cotard's syndrome raises incredibly deep questions about the nature of consciousness, self-awareness, and reality. What does it mean to be alive? It would seem like a simple question. Alive means you breathe, your heart beats, your brain works, biological functions. Everything is simple, right? But Cotard's syndrome shows that it's not that simple. Because in a person with this syndrome, all biological functions work normally, yet they still do not feel alive. It turns out that being alive is not only objective physical processes, but also a subjective feeling of life. This brings us back to an old philosophical question. What is more important, objective reality or subjective perception? If a person is absolutely convinced that they are dead, although all objective data says the opposite, who is right? We say that the objective fact that they are alive is right. But for them, their subjective feeling is their reality, the most real reality they experience every second. There is a philosophical idea by René Descartes. Cogito, ergo sum. I think, therefore I exist. Descartes believed that the only thing we can be absolutely sure of is the fact of our own existence, because we think. The very process of thinking proves existence, but Cotard's syndrome challenges even this seemingly indisputable truth. Because a person with Cotard's syndrome thinks, realizes that they think, but arrives at the conclusion, I think, but I do not exist. Or, I think, but I am dead. A paradox that Descartes could not have foreseen. This also raises the question of the nature of self-awareness. We are used to thinking that self-awareness is something stable, reliable. You are you, and you always know that you exist. But Cotard's syndrome shows that self-awareness is a fragile construction, assembled from many neural connections. And if these connections are disrupted, the whole structure can collapse. Imagine this. All your confidence in your own existence, all your identity, your entire self, is just a pattern of electrical impulses in the brain. And if this pattern gets disrupted, you can lose the most fundamental knowledge, the knowledge that you are alive. This is both frightening and awe-inspiring. Frightening because it shows how vulnerable we are, how fragile our psyche is. Awe-inspiring because it demonstrates the incredible complexity of the human brain. Another interesting point, people with Cotard's syndrome often talk about immortality. Remember, I mentioned it earlier. A paradox. A person believes they are dead and at the same time immortal. They are dead but cannot fully die. This creates a special kind of suffering. Imagine, you want to disappear, dissolve into nothingness, but you cannot. You're stuck in this state forever. It is like the most terrible curse from mythology. Tantalus, who can never quench hunger and thirst. Sisyphus, who eternally pushes the boulder up the mountain. Prometheus, chained to the rock. Immortality not as a gift, but as a curse. Some philosophers and psychologists see Cotard's syndrome as an extreme form of existential crisis. We all sometimes face questions. What is the meaning of life? Why do I exist? Who am I really? These are normal existential questions, but in Cotard-S syndrome, these questions reach such intensity that the person arrives at the conclusion, there is no meaning, I do not exist, I am dead. Cotard's syndrome is a rare, strange, frightening phenomenon, but it tells us a lot about how the human brain works, how our consciousness and self-awareness are formed. First, it shows that our perception of reality is a construct. We think we see the world as it is, but in reality, the brain constantly interprets signals, creating a subjective picture. And if something goes wrong in this process of interpretation, the picture can become completely distorted. Second, it shows the incredible plasticity of the human psyche. The brain can adapt to the strangest conditions, creating the most incredible explanations. And this plasticity is a double-edged sword. On one hand, it allows us to survive, adapt, and overcome difficulties. On the other hand, it can create pathological states, like Cotard's syndrome. Third, it reminds us of the importance of mental health. We often take our psyche for granted, but Cotard's syndrome shows that everything can change in an instant, after trauma, after a stroke, in the context of severe depression. And this is not weakness, not a personal failure. It is a medical condition that requires treatment. Fourth, it emphasizes the importance of empathy. When someone says, "I feel dead," it's easy to brush it off. Don't be silly, you're alive. But for a person with Cotard's syndrome, this is not silliness. It is their reality. And what they need is not criticism, but help, understanding, and support. Finally, Cotard's syndrome reminds us how little we understand our own brains. Despite all the advances in neuroscience, psychiatry, and psychology, there remain enormous mysteries. We do not fully understand how consciousness arises, how self-perception is formed, why some people are resilient to mental disorders while others are vulnerable. So, yes, Cotard's syndrome is a story about walking corpses, but it is not a zombie movie. These are real people with real suffering, people who have become lost in the labyrinths of their own minds and are trying to find a way out. And our task is not to fear them, not to turn away, but to try to understand and help. Because in the end, the boundary between normal and pathological is much thinner than we would like to think. And who knows, maybe understanding extreme conditions like Cotard's syndrome can help us better understand ourselves. Ordinary, normal people who wake up every day, look in the mirror, and without any doubt know, yes, this is me, I'm alive, I exist. This knowledge, which seems so simple, is in reality an incredible achievement of the complex work of billions of neurons. And as long as this work is going normally, we don't even think about it. But if something goes wrong, we realize how fragile everything is, how amazing everything is. Cotard's syndrome is a window into this fragility, a dark, frightening window. But it is by looking through such windows that we learn more about ourselves, about human nature, about the mysteries of the mind. And that, is damn fascinating.